Well, at the most basic level, it's a set of biologically based characteristics that are the result of genetically based differences in the part of the brain that's involved with paying attention. And in sort of the model and approach that I've used based upon these 30 years of experience, I think that there's sort of like 8 core characteristics that sort of are hallmarks of ADD. First, people with ADD are what we call under-aroused, meaning they're not as awake and as alert as they need to be in order to pay optimum attention. Sometimes that's a head scratcher for people because the word hyperactivity so commonly is used in conjunction with ADD that people have the mistaken notion that people with ADD have these hyper-aroused, hyper-alert brains, when in reality, for the overwhelming majority of people, it's the exact opposite. That shows up day to day in struggles to get up and wake up in the morning time. It leads to sleepiness and fatigue during mundane activities during the day, whether that's reading a book or listening to a lecture. And I think, in fact, it's responsible for some of the fidgetiness and hyperactivity that we commonly see with people with ADD, because to keep that arousal level up, people do a lot of self-stimulatory behavior, wiggling in their chair, bouncing their leg, tapping their pencil, getting up and walking around the room. All those activities send messages up to the part of the brain that's involved with paying attention that are saying, stay awake, stay alert. And interestingly enough, when we give people with ADD medications that are generally stimulant medications, they don't work in a paradoxical way to calm people down. They actually wake people up. They make them more alert and more aroused, and because now there's no longer the need for the leg bouncing and leg tapping, people become more calm because they don't need that extra behavior.